Hello, everyone. Hello, everyone. And a very good afternoon to all of you. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UVA and UVB rays, which makes skin more prone to wrinkles, melasma, and skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to a survey, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware, and that makes us to not include sunscreen as an integral part of our skincare routine. Today, we are here to be aware about how to identify the best sunscreen for our skin. So let's connect today with our skin expert, Dr. Radhika Gupta Heranjal, live from Vapi, Gujarat. Dr. Radhika is a renowned consultant dermatologist with expertise in laser and cosmetic treatments. She is founder of Heranjal Advanced Dermacare Center, Vapi, Gujarat. She has worked as consultant in Kaya Skincare in Mumbai and ex-HOD of Sri Vinoba Bhave Civil Hospital, Silvassa. Currently also working as a consultant with ESI Group of Hospitals and has an experience of 8 years. Doctor is well versed with histopathological assessments and diagnosis, proficiency in cosmetic procedures, namely chemical peeling, substitution, microneedling, RF, Botox fillers, threads, cryotherapy. So, Doctor, a very, very good afternoon to you and welcome on this great platform.
Thank you. Thank you so much.
Doctor, as today we'll talk about what sunscreen is best for us. So let's begin this session with knowing that why should we wear sunscreen? Because as I have mentioned in the beginning that, we have all our excuses about not using sunscreen. Still, 67% of people in India are not using sunscreen. That's a matter of concern. Why should we wear sunscreen every day?
Yeah, so sunscreen is a very detailed topic, and honestly, I feel 1 hour is just not enough to discuss it. But irrespective of what the subtopic is, I think it's most important to first discuss why we should wear sunscreen, very rightly said. So I feel currently nobody is going to be there who's going to say that sunscreens are not important. I think anybody who we speak to, they know they are important. But the problem is that people don't know how important it is. I think that's where the barrier comes, and that's where probably we become lazy in wearing a sunscreen. So what we have to understand is that this sunscreen is not just something that protects you from natural sunlight. It is something that protects you from all lights. It protects you from the various ultraviolet radiations that we get from the sun, namely the UVB radiation and UVA radiation. Not just that, it also protects you from the infrared radiation that is also there, which is basically the heat that we feel when we sit in our cars when it's been out in the sun for a while. Not just that, it also protects us from the artificial light, the LED lights. A lot of people say, "Jab se COVID chal raha hai, we've all been indoors." But the artificial light that we are exposed to, the LED lights, the incandescent bulb, the blue light that is there from our laptops, our TVs, all our screens, all of that damages the skin. And that's why sunscreen is very, very important. The damage can start from something as simple as a rash, to a simple tan, to a prolonged tan, to a sunburn, to an urticarial rash, to an allergic rash. It can progress to early signs of aging, early signs of photoaging that we see in the form of freckles, dull skin, uneven skin on the face. And it can go as far as to give us wrinkles on our face. And of course, if there is prolonged sun exposure and we're not wearing sunscreen and we're outdoors, it can also lead to skin cancers. So all of this needs to be kept in mind, and hence it becomes imperative that sunscreen should not be considered as just a cosmetology or just a cosmetic product. It is an important ingredient in our everyday skincare.
I think that's very important to know that, it's very, very essential for the health of our skin, a healthy skin. And, as the doctor just said, that even if the name suggests sunscreen, it's not only protecting your skin from the damage caused by suns or the rays which are emitted by sun. It's also protecting your skin from all the other light sources as well, especially the laptop, which me and the doctor are in front of, and the mobile, which we are, all the time these days. So please, please, please wear sunscreen every day. That's very, very, very essential. Doctor, now we know that, sunscreen is very essential. But when I go and buy a sunscreen for myself, what are the criteria that I should keep in my mind? How to choose the best sunscreen for an individual skin?
Okay, yeah, so that's basically what we'll be discussing in detail today. And I feel since 2019, we've had really good regulations and guidelines that have been put in place. So currently, identifying a good sunscreen for oneself is really not that difficult, because I'll tell you what, 90% of the things are on the box. We just need to read, recognize, and understand that. And I hope to cover most of them in today's talk. So for example, so I won't be talking about any particular brands, because honestly, there are like probably thousands of sunscreens in the market and it's physically impossible to discuss them all. But I'll still show you a couple of recommendations of sunscreens that I commonly use, and just how to go by it, understanding. So if I would start with this, so this is a sunscreen that I regularly prescribe for my patients. So it's literally all on the box. If you see, it tells you how much SPF is there in the sunscreen. It tells you what the PA factor is. So I think we're going to discuss the sunscreen and PA factor part of it again.
Yes.
It tells us that it gives us UVA, UVB, and visible light cover. All three are very important. It's an oil-free sunscreen. So anybody with oily skin, with acne-prone skin, males who are outdoors a lot, it's going to help them immensely. It's not going to get them to break out. It is non-comedogenic. So again, they will not break out with the sunscreen. Non-comedogenic basically means anti-acne, and it is very water resistant. So when it says water resistant, that means it also is going to, the vehicle in the sunscreen is going to stay longer, irrespective of how much we sweat, or if we are, or there's any kind of water exposure to us. So swimming, I would not say much, but yeah. So this basically gives me a lot of information. So the box has a lot of information, and that helps me selecting what kind of sunscreen I want. Also, that's one thing. So that's the information on the box. The second thing is understanding what kind of skin you have. So sensitive skin will require another kind of sunscreen. Oily skin, dry skin, irritated skin, a young child skin. So even age makes a difference, and all of that. So if I'll pick up something else, so yeah, so if there's one more sunscreen that I'd like to show. So here it says, it also has blue light protection, like right here. It says that this sunscreen has blue light protection. It is, I think, an SPF, again, a 50 sunscreen, not too much PA factor. So this tells me that it's a good indoor sunscreen. It does not give me too much UVA protection, good UVB protection, good blue light protection, and it is paraben free. So that again works for me. Paraben is a preservative that we use to increase the shelf life of sunscreens, but they're not necessarily good for our skin. So a product that says paraben free definitely should be considered. So these are a few things that if you keep in mind, it's very easy to pick a sunscreen. It's literally on the box.
Right. So we need to just understand the requirement of our skin as per our skin type. That's also criteria that should be kept in mind, a very important one, definitely. And then we can just go and buy the best sunscreen for us. Every detail is there on the box. As doctor, you were mentioning the box, you said that there's something we'll discuss again in detail, and that was the SPF level, pH level. Now, what is SPF level? We all know that sunscreen has those SPF levels starting from 50, 20, 30, 50, 60, but we don't know what it stands for and what SPF level is good for us.
Right. So SPF very quite simply stands for sun protection factor. And in layman's term, if you understand, an SPF tells you how many times, what amount of radiation, especially UVB ultraviolet radiation, the skin can withstand. Again, I would not want you to go in much detail. That's what I tell most of my patients. Most of our patients today, or people attending today's talk, are probably from India, and we live in a subtropical, tropical country. And we've just had a very, very intense summer. So I would say it is a no-brainer. It has to be 30, 50 or a 50 plus SPF for an everyday person who probably goes out to work and comes back. 30 also, I'm being a little generous. Honestly, if you take my opinion, I would say it has to be a 50 or a 50 plus SPF sunscreen. 60 plus, I don't always recommend. If you're a swimmer and your outdoor exposure is longer than 3 to 4 hours, then probably yes, with repeated applications, and SPF 60 will help you. But for a normal everyday person who leaves work or who's even at home, a 50 SPF sunscreen is absolutely essential.
Right.
It just tells you your UVB protection potential of that particular sunscreen.
Right. And we should also check for that pH level that it, balances our skin's pH level as well. 5.5.
5.5 pH is very important. And the PA factor also, like I said, under the sunscreen, this PA factor should not be ignored. It also gives us an idea. It gives a good star rating to the sunscreen. It tells us how good it is at reflecting UVA radiation or absorbing and transforming UVA radiation. So definitely an SPF 50 with a 3 or 4 plus good star rating makes almost an ideal sunscreen for everyone.
Right. So the first sunscreen box that you displayed was a gel formulation. There are so many, various formulations that's available. Now, probably we know that gel is good for oily skin, but you also mentioned that if you have a sensitive skin, you need to, go for a different sunscreen. If you have a oily skin, then your requirement is different. Please elaborate on that. As for my skin type, which sunscreen should I go for? Do I need to consult my dermatologist before I buy a sunscreen?
So definitely, if you visit a dermatologist, your understanding of your sunscreen will improve considerably. And that is one thing. Second thing is a dermatologically tested sunscreen, which is not always available over the counter, which you get from a pharmacy, is far more superior, I feel, as it is more focused on just giving us sun protection. Many other sunscreens nowadays that we're coming up with that are just commercial sunscreen, over-the-counter sunscreen, would probably say something like also skin lightening effect. And that is something I absolutely don't try to go for, because I feel that's too many things that you're asking a simple product to do. And it not only increases the cost of the product, but it decreases the efficacy of the product as well. So coming back to the skin type and what sunscreens to use. So somebody who comes with so again, I divide that into very commonly male and female. Males have more oily skin. They have more sweat and sebum secreting skin. So a gel-based sunscreen, silicone-containing sunscreen is very good for them, as that helps in minimizing the amount of breakouts that they would have. A non-comedogenic sunscreen is again very good for male skin and acne-prone skin. So that is something that you should really look for, a sunscreen that says non-comedogenic sunscreen, oil-free sunscreen. That is again something that you should look for when it comes to males, when it comes to acne-prone skin. If it's a younger skin, a relatively immature skin, somebody who's probably in the age group of 12 to 16, they've got young, nascent skin. For them, I would definitely recommend that they can go for physical sunscreen or mineral sunscreens as we know them. So these are sunscreens that mainly contain zinc oxide. So they're like a skin block. You put them on your skin and they're just reflecting the light. They're not necessarily absorbing the chemical and then working on it. So that is something to consider. Then there are many people females especially, who complain of dry skin. So for them, sunscreens with moisturizer, sunscreens with some amount of vitamin E or C will definitely be beneficial. Then we have broad spectrum sunscreen. Again, sunscreens, again, I'm just trying to see what I have here, but there are some sunscreens that mention that they are broad spectrum sunscreens, right? So that is also something to look out for. That just tells us that it's going to give us more protection, right? Then there are some sunscreens, people with sensitive skin. Sensitive skin is a very big issue nowadays. And I feel almost everybody feels their skin is sensitive, when probably it's not. But still, if you've had atopic skin or allergic skin, or you say the doctor, I break out when or doctor, I get a rash when I use too much sunscreen. Again, a mineral sunscreen is ideal for such people, and that's what they should go for. So yeah, that's covered pretty much. Most of them, yeah. Achha, another thing that we have are tinted sunscreens. Nowadays, tinted sunscreens are a rage. So if you have sensitive skin, acne prone skin, not sensitive, but more acne prone skin, and you don't want your marks to show, at the same time, you don't want to wear a foundation, you should go for tinted sunscreen. They have a little bit of pigment that just gives you a little bit of a mattifying effect, and sunscreen won't feel heavy on your skin, and you won't have to wear a foundation.
Okay, so you have all the kinds, types of sunscreen and various formulations. Just choose the right one as per your skin type and the requirement of your skin. And doctor, now, we know what type of skin we have. We have the sunscreen with us. Now the main part is how to apply it, when to reapply. These are the questions people again, I mean, daily, really do we need to wear it daily? We have answered that already. But then again, daily, we have to keep on reapplying it. What's
the... Absolutely. So a sunscreen, as soon as you put it on your skin, it starts working. Whether it is a mineral sunscreen or a chemical sunscreen, as soon as it's on the skin, it starts working. And anything that starts working starts exhausting itself as well. At the same time, our skins are really, meaning, like, again, coming back to the kind of city we live in, the kind of country we stay in, we sweat a lot. And that cream or that gel, that's our vehicle. And as soon as we apply our sunscreen and our skins look great and we think we're ready, but then we go in our kitchen or whatever and we start sweating and we start wiping that sunscreen off. So the sunscreen is working, it's getting absorbed. At the same time, we are wiping it off, or we are sweating and then we are dabbing it. Everything removes the sunscreen from the skin. But we do need constant protection from 10 a.m. to 4 p.m. because that's the time when the UVB rays are maximum. So it's really important that we reapply our sunscreen in order to ensure adequate protection. एक बार भी लगा के छोड़ सकते हैं, but 3 घंटे के बाद उसका असर नहीं रहेगा, right? So make sure you reapply your sunscreen every 2 to 3 hourly if you're outdoors. Immediately after swimming, if you're a swimmer, and if you're indoors, then probably twice a day application should suffice. But reapplication of sunscreen is very important. Acha, amount, coming to the amount.
Yes.
Sometimes we can be very stingy with how much we use, or it's just that we don't know. So there is something known as 2-finger rule with the sunscreen. Most of the ointments or medicated creams that we use 1 fingertip unit. So we just use this much and we apply it on the face. That's not the case with the sunscreen. You need 2 fingers. You actually need this much sunscreen to cover your entire face and neck at every application for it to be effective. It probably will take a minute to rub it in, but that's when you know that you have thoroughly and properly applied your sunscreen, and that's going to protect your skin.
Right. So apart from buying the best sunscreen for your skin, it's equally essential to know how to apply it, how much amount to take, and the reapplication is equally important. Otherwise, your sunscreen won't work because it will get exhausted. Now, the thing is that because we are using sunscreen every day throughout our life, and that again and again, so that's one product that's going to stick to our skin for a long time. We have various kinds of sunscreen, definitely various things, ingredients are going into our skin. Now the question is that, are these sunscreen toxic? Can they damage our skin at any point of time?
Yeah, so that is a very important question, and that is a great question because I think almost every patient who comes into my OPD probably ends up asking me this. If they don't ask it, they feel it कि कोई चीज हम बार-बार लगा रहे हैं तो उसका कुछ तो असर होता होगा. So you need to understand that when it comes to toxicity, the absorption and toxicity are 2 very different things. When it comes to toxicity, I think we should probably watch out for the sunscreen sprays and the sunscreen powders that have come up, because there is a possibility of oral inhalation, and that's when the compound actually gets inside the body. That's when the UV filter is actually consumed by us. But when it's about topical application, yes, there are some UV filters, your avobenzones and your oxybenzones, that are absorbed, and they are absorbed systemically, but the concentration is so little that it never reaches a toxic level. So that is something that we need to be clear about, that absorption is different from it being toxic, right? So, and at the same time, there's something that we can really not ignore, the fact that we've been using sunscreens for generations in order to prevent skin cancers, and that's what they do. So we really don't expect them to become toxic anytime soon, and they've proven to be efficacious in preventing cancers. So that is something that definitely tips the balance in the favor of sunscreen being non-toxic and with not many severe side effects.
Sure, right. And doctor, how do we, measure the effectiveness of a sunscreen? How effective that sunscreen can be? How far can it go to prevent my skin from any kind of damage from sun or other sources of light?
So definitely your SPF, when you read it on the box, and if your application is proper, and if your reapplication is proper, that in itself is understanding enough. But when you use it consistently, so anything that is used for over 21 days basically becomes a habit, and that's what we're trying to go for when it comes to sunscreens. When you use it enough, you will see a visible improvement in the quality of your skin. The fine lines that actually tend to come with aging or before aging, you will not experience that. The tan that otherwise is very common will not develop, and your skin will remain fresh and clean. So that will definitely give you an idea of how effective your sunscreen is.
Right. And what is the right age to start using sunscreen? Can infants or kids should also apply sunscreen?
I think we can remove Parul from the
Yes, it's mute now. Yes, doctor.
Yeah. So what was the question? I'm sorry.
I'm asking that what is the right age to start using sunscreen? Can kids, infants, they use sunscreen as well?
Oh, absolutely, absolutely. Nowadays, I have 3-year-olds with their mothers coming and telling me, "Ye dark ho rahi hai, isko main roz sports," because nowadays kids are active. They go out for outdoor activities, swimmings, and athletics and workouts. They start at a pretty young, tender age of 3, 4, 5. So ideally, 6 months and under, absolute no. It's not required. You wear well-covered clothing and you just stay. Try to cover the kids when he's outdoor, when he's indoors, it's fine. So 6 months and under, nothing. But anyone above 6 months of age should absolutely go for physical sunscreens. I feel up until the age of 6 to 7 to 8 years. And after that, they can shift to broad spectrum sunscreens, mineral sunscreen, your chemical sunscreens. So yes, 6 months and above, if you're going out, just put sunscreen.
So it's very clear now, 6 months and above, please start using sunscreen is very, very, very essential. We'll also pick some of our viewers' question as well. Sanjan Yadav is here asking, how do I choose the best sunscreen for me? My skin is very dry.
Okay, so if your skin is very dry, and I'm assuming he's a male, so yes. I know that with males, we need to add an extra criteria that they are not going to use too many products on their face. So I feel a cream-based sunscreen, so the base should be a cream and not a gel, because that will take care of the moisturizing and giving you the sun protection factor. If you're in India, so anything above SPF 50 or SPF 50, PA factor 3+, because you're a male non-comedogenic sunscreen, will work for you. If it says micronized or other things, that's great. But I think as long as it's non-comedogenic, cream-based, SPF 50 sunscreen, that should work for you. Anything in that range will work for you.
So Sanjan has his answer now. Parul Rekha is asking, hello ma'am, should I really apply sunscreen when I'm indoors?
Absolutely, Rekha, because please understand. So when you're sitting in an office, which most of us are nowadays, thanks to COVID and or whatever post-COVID, there are big windows, and that is pulling in a lot of. There might not be much of UVB ultraviolet radiation or UVA ultraviolet radiation, but there is so much infrared radiation, which is just as damaging. When you're working in the kitchen, there's usually a window in front of your slab where you're working, and that again pulls in a lot of light. The heat from the fire of the kitchen gas, and the heat that you get when you go around in your car, all of that is damaging your skin, and we don't realize that. Most importantly, the incandescent bulbs nowadays, we don't have tube lights, we have like 10 LED lights in our house. All of that is creating radiation, and all of that is damaging. I'm not even starting to talk about the laptops and the phones that we have our noses in throughout the day. But trust me, there's so much radiation that a sunscreen indoor with reapplication is absolutely imperative.
Okay, so no matter you're indoor or outdoor, maybe it may affect the application and reapplication, but you need to apply sunscreen. That's the mantra. Now Sonia Rajan is asking, ma'am, in my body and face, many areas are affected by sunburn. How can I reduce them?
Okay, so reduce sunburn. A lot of sunscreens do mention on their box that this helps with sunburn. So first, look for sunscreens that say it helps with sunburn, because they have those soothing agents. They have some amount of aloe vera in them, and that helps in just calming the skin down. If you've already had a burn, if you have an active burn, first I would recommend that you visit your nearest dermatologist and you take a consult, because some of them do require other medication and not just sunscreen. But in order to ensure that your burn doesn't worsen, like I said, socho bhi mat, do use a sunscreen on top of it. If it is an active burn which has a rash, the skin is still red or peeling, probably go for a physical sunscreen, a mineral sunscreen, and not a chemical one, but definitely still use sunscreen.
Right.
Another thing that I would like to add here, a very common ingredient that we all have in our houses, a very common cream that we all have in our houses that we ignore, lactocalamine. Lactocalamine is also a physical sunscreen with an SPF power of 15. So when you've got a very sensitive skin or you've got a burn, like you said, just applying lactocalamine religiously, thoroughly, evenly, regularly will help you with sun protection and the healing of your burn.
That was an interesting, takeaway as well. You can use the lactocalamine lotion that's there in your house. Radhika Soni is here asking how to fix an uneven skin tone and working lifestyles, because normally people have a very hectic lifestyle. Yeah. What should she do?
So, Radhika, hi, that really depends on the cause of your uneven skin tone. A lot of us are born with uneven skin tone. We have pigment demarcation lines on our face that's basically genetic, and we can only but control them and prevent them from worsening by wearing sunscreen. But if your cause is anything else that requires, the first thing that I would say is take a dermatological consult, understand why you have the pigmentation, and then work on it. So sunscreen is going to be your first line of defense. Your oral vitamin C's and your oral vitamin E's, vitamin A, vitamin D's, they will literally act as some amount of oral sunscreen. But then definitely to pinpoint the cause and treat it, you need a consult.
Right. So if you're facing any kind of skin related issue, no matter how small it's looking, please go and consult your doctor, your dermatologist in this case, before it becomes, really big or a huge problem. Please consult your dermatologist. Atvik Singh is asking. Yes, doctor.
Yeah, another thing I'd like to add there is a lot of us wait till our skin becomes bad to visit a dermatologist. So we wait for a burn or a tan or a rash. In today's day and age, we need to understand that we need to understand our skin, and our dermatologist is one person who knows it very well, not the pharmacist, not your friend, not your Instagram buddy or your Instagram trending person, whoever that is. So just to understand your skin also, if you visit a dermatologist, a lot of your doubts will clear. You can formulate a very nice daily routine with them, And then probably you won't have any of those issues of, uneven skin tone or dull skin otherwise.
Right. You know what happens with us if, for example, I have some problem going into my heart, I'll immediately go and consult a doctor.
Oh.
I won't sit and hear to everybody. I'll just go and consult a doctor because I feel that's serious. But with skin, though it's the largest organ of our body, still
Exactly.
we kind of, ignore, or we'll just wait, keep on waiting, do home remedies, try other things, and then land it to our doctor. By then, it's too late, and many times it becomes very, very difficult to, repair what damage has already been caused. So it's very important to consult your doctor at the right time. So even a small rash, a small patch, a black, whatever is on your skin, anything that's bothering you, not usual, not normal, please go and consult your doctor, your dermatologist. That's very important. I'll take few more questions. Okay, Advik Singh is asking a very interesting question. What is the best alternative for sunscreen? I would also like to add to Advik's question that many times people will use hat or cap or cover their face with a cotton cloth or scarf, and they'll say that I'm sun protected. I don't need any sunscreen. What's the truth?
Okay, so very good question, because I'll tell you what, in now when we're dealing with sun protection issues, and now that the awareness for sunscreen is rising, a lot of people say, doctor, मैं तो पूरा दिन sunscreen लगाता हूँ, मैं तो reuse भी करता हूँ, फिर भी मैं काला हो रहा हूँ, ऐसा क्यों है? So that's because he's also saying कि लेकिन मैं पूरे दिन धूप में भी रहता हूँ. So just understanding the fact that just because you want sunscreen now, nothing will happen to your skin, that's not true. That's also not accurate. So when we're talking about sun protection, there needs to be a wholesome protection where not only you need to wear sunscreen, you need to prevent as much sun exposure as possible. You need to protect yourself as much as possible. You need to also wear light colored clothes so that you don't absorb the heat. You need to take other precautions as well. And only then you can ensure with absolute certainty that your skin will not be damaged or tanned. So answering your question, if you don't like to or prefer to wear sunscreens, it's a little hard, but you can always wear denim or a denim like material, because that's the only material that's been proven to protect sunlight, that's been proven to prevent your sunlight from coming in. And that's something. So unless you're planning on wearing denim on your face and denim on your body, that's probably the only thing that's going to effectively protect you. But apart from that, I would say wear a cap when you're outdoors. Try to carry an umbrella. Abhi to barishein bhi aane wali hai, so that will help. Again, cloudy weather does not mean your skin is not tanning. Your skin is still tanning. There is still radiation. There is still UVB light. So UVA light, a lot of it is protected when it's cloudy, but UVB light will still come in. It will still penetrate your dermis. So umbrellas, caps, light colored clothing, thick clothing, covering yourself with it and minimizing your exposure will help. Probably those thick sleeves that you get to wear, so you'll have to roam around like really protected, and that then there is probably some amount of protection that will come close to protecting you as a sunscreen does. But I still recommend itna mat socho. It's not a big deal. It's just a matter of habit. Start karo and you'll really get into the habit of it. It won't be a big deal.
Yeah, I don't know even what's stopping Advik from using sunscreen. Please, Advik, go and get a really good sunscreen as per your skin type, your skin requirement. If you have any kind of, doubt, please go and consult a dermatologist. Use other ways, but sunscreen is a must. Sonia Singh is asking, ma'am, does sweat cause acne? And many times people say that they are not using sunscreen because it made them sweat a lot. It's making their skin more oily. Acne are coming out. So along with her question, I'll add that point as well.
So if you sweat a lot, definitely go with the sunscreen that are really light, sunscreens that evaporate fast. So sunscreens that are gel based help you when you sweat a lot, and they really help you in preventing sweat. So I think this is a really age-old concept that sunscreens make you sweat. Nowadays, with micronized sunscreens, with the silicone sunscreens, with tinted sunscreens, I think sweating with sunscreens has kind of become a thing of the past. So I think you just need to visit a good dermatologist or your nearest dermatologist and get an idea of what other products are there in the market, because there are new innovations happening every day. And what was your other question?
Yeah, but, the same, that people uses a lot of excuses like we sweat a lot, etc. But Sonia Singh's specific question was, does sweat cause acne?
So no. If you want the exact answer to that question, no. Sweat does not cause acne. Acne has many other causes, 5 major causes associated with sebum. So I hope you're not confusing sebum with sweat, but excessive sebum secretion can lead to acne. Excessive sweating does not cause acne.
Okay. Rachna Sharma is here asking, ma'am, spray sunscreen is also available. Are they okay to use?
So pros with spray sunscreen, you can use it on top of your makeup. So people who wear makeup every day and then say, how will I reapply my sunscreen when I already have makeup on? So definitely spray sunscreen, powder sunscreens, and your stick sunscreens are to the rescue. So better than not applying, you go for a spray sunscreen. Yes. Number two, they feel very light. Again, with the spray sunscreen, it doesn't feel heavy on the skin. You won't sweat as much. So those two things are pro for spray sunscreen. The cons, like I just said before, there's a very high chance that you will inhale your spray sunscreen. So you have to be really careful of that, because then it can be slightly harmful for your body, because then you're taking in them, you're systemically absorbing them, the UV filters. And second thing is, you have to be really aware of how much you're spraying. There's always going to be uneven distribution when you're using a spray sunscreen, unless you're very careful. So then you might have patches of tan if you're not very careful with even distribution. That is one issue that sometimes can come with a spray sunscreen.
Okay. A Raju asking, would it be better to incorporate vitamin C in my day and night routine? I think he's talking about vitamin C serum.
Yeah, well, serum, gel, cream, khalo, anything and everything vitamin C works. So it's great for skin. So yes, but then definitely depending on your skin type, you decide whether it's a gel that you want or a serum that you want, whether consumption would be better. So again, visit your dermatologist and then take a call.
Okay. Krella Belle Howard asking how to choose best sunscreen for oily skin.
I think we've already covered this.
Yes.
Oily skin, it has to be it has to say on the box, because then we know then at least we can assume that, or be kind of sure that that's that. A dermatologically tested sunscreen, gel-based sunscreen, non-comedogenic sunscreen, and oil-free sunscreen, probably paraben-free, PABA-free sunscreen. And it should also sometimes say light sunscreen. I think when it says those 4-5 things, and then I think, and water resistant, of course,
Yes.
that also, because oily skin meaning you are going to wipe it off sooner than later. So definitely it should say water resistant. Yeah.
I'll pick a couple of more questions before we wind up. Sharif Muhammad Sheikh is asking, I have a dark spot around my lips. How can I reduce it?
Visit your dermatologist.
Yes, don't be a self-doctor. Don't just buy anything over the counter. Go and consult your doctor before it gets too late.
Yeah.
माधुरी सोनी is asking, गर्मियों के लिए सनस्क्रीन में कम से कम कितना एसपीएफ होना चाहिए? डॉक्टर, क्या अलग अलग एसपीएफ होने चाहिए मौसम के हिसाब से?
See, it's very, I think person to person vary karta hai, doctor to doctor vary karta hai. I really don't mind if it's very cold and the sun has not come out and you don't go out, that you go for an SPF 30 sunscreen. It's fine. But गर्मियां हैं तो चाहे अनचाहे भी हमारा रोज का 1 घंटे का there is sun exposure. So an SPF 50 or 60 is really advisable, is really something that you should go for. So summers, more sunscreen, winters, less sunscreen, autumn or rainy season, I would still say an SPF 50 at least.
Right.
Yeah.
And before we wind up, any concluding note, anything that you would like to share with our viewers?
So like I said, sunscreen is a very long talk. There's no end to how much information I can give you on it, but there's only so little time. Take home message that I tell most of my patients very simply: you go for a bath, you need to apply something afterwards. Let that be your sunscreen. You finish your kitchen work if you're a housewife, and then you need to wash your face and hands. There's something you need to apply. Let that be a sunscreen. You go out in the evening, there's something you need to apply. Let that be a sunscreen. Even if you're indoors and you get up for lunch, because a lot of people tell me, "Baar baar to kar hi nahi sakte." But I tell them that 3 to 4 times a day you go into the bathroom and you do wash your face. So all I'm saying is, after that, apply something. Kuch to lagana hi hai, let it be a sunscreen. You will see a tremendous improvement in your skin, and you'll know why. So start using it, and with use and reuse, you'll understand how a sunscreen affects your skin. And sunscreen is probably one of the few products that anti-aging sunscreen, light protection sunscreen, radiation protection sunscreen, helps with wrinkles sunscreen, helps with dull skin, removes tan, decreases pigment demarcation lines. There are so many things that it does. So what's stopping you?
Exactly our question. What's stopping you? Please go and get a good sunscreen as per your skin type, as per your skin requirement, and start using it. And in case you're in doubt or anything that's bothering you about your skin, please go and consult your dermatologist. That's very important. Thank you so very much, Dr. Radhika Gupta, for your valuable time. It has been a very informative session for our viewers. It is really great to hear you. We really look forward for many, such sessions for our viewers in coming time. Thank you very much.
Thank you. Thank you so much.
And we would also like to thank our viewers for your participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Goodbye. Have a great day ahead.